The aspiration irrigation maneuver is designed to aid in the diagnosis and treatment of acute and chronic sinusitis. Unlike the displacement maneuver, PRETS, the aspiration irrigation maneuver works with Bernoulli's principle and the Venturi effect to physically remove the contents of the maxillary, ethmoid, and sphenoid sinuses. It also offers the advantage of keeping the child in the mother's arms. Older people with arthritic necks tolerate the upright position much better, and unlike PRETS's maneuver, it can be used in acute infections as the gravitational forces protect against contamination of other sinuses. This procedure is both diagnostic and therapeutic. The contents of the captured product can be gram-stained or cultured, and the results of laudable pus correlate with the needle aspiration greater than 60% of the time. In this present age of resistant microbes, this procedure can help determine not only whether purulence exists, but help define the indicated antibiotic. It is important to stress that the procedure is an adjunct, not a substitute for other methods of treatment. The aspiration irrigation maneuver requires an open ostium and therefore is not effective in emptying the maxillary sinus in an acute infection where the ostium is swollen shut, and again correlates to the needle aspiration cultures only 60% of the time. However, unlike any other means, this procedure helps empty all other sinuses. It can be used to clean post-operatively in functional endoscopic sinus surgery by atraumatically removing the debris that can otherwise, oftentimes, lead to post-operative secondary infections. X-rays on the left show ethiodyl-filled sinuses by displacement maneuver. X-rays on the right are post-aspiration irrigation maneuver. Notice the nearly complete emptying of sphenoid sinuses and 60% clearing of ethmoid and maxillary sinuses. The nasal vestibules are cleaned with cotton-tip swabs and peroxide, and the passages are prepared with vasoconstrictor agents. Saline is then introduced to one side of the nose with a bulb syringe and aspirated from the opposite by the aspiration irrigation apparatus. As the patient repeatedly says the letter K throughout the procedure to close the velopharynx, the water dribbles down the afferent side of the nasopharynx, and the vacuum from the apparatus pulls the saline more rapidly along the efferent side, thereby creating a Venturi effect as it passes by the ostium. The aspirated contents are caught in a trap and can be used for gram stain or cultures, or displaced by the tilting of the apparatus back into the suction tube. After 2 or 3 aspirations, the instrument is reversed to the opposite side. The procedure is somewhat side-specific in that the efferent side is the one that is emptied. Again, the contents can then be submitted for cultured or gram stained. The only complication associated with this procedure experienced thus far is an occasional nosebleed, which is usually found in those who are already experiencing recurring epistaxis. The theoretical possibility of aspiration of saline in actuality is more therapeutic than true risk, in that the aspirated contents are from the efferent side and therefore pure saline. The limitations of this procedure are the occasional uncooperative 4 or 5-year-olds and children with large adenoids, unilateral choanal atresia, a marked septal deviation, or a cleft palate. In conclusion, the aspiration irrigation maneuver is a safe, simple, painless, inexpensive therapeutic and diagnostic procedure with many uses in the treatment of acute and chronic sinus disease.